Well, happy Friday. Glad it's the end of the week and good to see everyone this morning. We'll go ahead and get things started. We have a very exciting interview coming up with Dr. DeLon Canterbury. He is a board-certified geriatric pharmacist and is the founder, president, and CEO of GeriatRx. I just have two quick announcements before we begin. The first is a reminder, our next monthly coalition meeting is Friday, October 21st, 11 to 1. And then second, as always, please make sure to put your name and organization in the comment box and share any questions that you have along the way. And with that, we'll go ahead and get things started. Heather.
Great, thank you. Good morning, Coalition. Welcome, and good morning, Dr. DeLon Canterbury, my new friend. We've been friends now for a few months, and I am so excited to be able to have this conversation with you with friends around the boxes. There's so much for us to talk about. You have so many words that describe you. As Virginia said, you're the CEO of GeriatRx. You're a certified community pharmacogenomics consultant. You're a deep prescribing coach. You're an implementation strategist. You're a concierge pharmacist, a geriatric care pharmacist. There's so many words that we're going to spend the next few minutes describing. But before we dive into all that, I just want to say welcome and ask you to take a few moments to tell us about you and where you're from and your background that brought you into this cool work we're going to talk about.
All right, love it. Yeah, morning everyone. And thank you for having me on. As mentioned, I'm Dr. DeLon. Thanks for the warm words. I am a burnt out pharmacist is usually how I start. And I actually hail from Atlanta, Georgia, and was born in Brooklyn and lived there for about 7 years before we moved and grew up in Atlanta with my family. So my parents actually came from South America. They came from Guyana, little country there, and immigrated in the 80s to have a better life for their kids. And so I'm the oldest of three. My brother Devon and Dacia. My brother's a talent scout for a Universal Music Group, and my sister is a photographer and eco-friendly, sustainable kind of extraordinaire. So I stayed in the Triangle, really coming to UNC. I'm a Tar Heel, go Heels, of course. And finished up pharmacy school in 2015, and so I've fell in love with the area. I thought I would go right back to Atlanta, but I've been here since then. So really honored to meet you all today. And yeah, can't wait to continue telling about my story.
Yeah, no, we'll keep going. I mean, we're always excited. I'm a Tar Heel too, so always excited to hear what people in North Carolina. But all right, tell us about what brought you into the world of pharmacy excitement.
Yeah, sure. So let's do it. So with my parents and our Caribbean culture, my mom basically was this de facto natural medicine specialist, right? Like she knew like all the herbs in the yard, which one's for healing, which one's for cooking, which was poisonous, and out of necessity, right? And so she brought that culture here to the States. And well, that's how she raised her kids as we got sick. I had asthma and all this weird stuff. So we would use natural products and, Vicks, Tiger Balm, like bitters, boiling stuff, trying to heal ourselves, right? Trying to heal the body. So that got me really into the world of pharmacy because I was intrigued by, okay, what do these plants do? How does it work? And so I wanted to know the nerdy science behind it. And well, that frankly led me to UNC. So fast forwarding today, I'm a pharmacist basically, and started getting my first little dance into the profession in Henderson, North Carolina. So I was the pharmacy manager for Walgreens, and I was a pharmacy tech while I was in school too. And basically that was my home store. That was where I started seeing all the issues that our health system brings upon our seniors and really our patients of marginalized communities as they come to the pharmacy counter with multiple social issues and really no one taking the time of day to like do for them. And so working as a pharmacy manager, I started realizing I was pushing people to meet these BS metrics, right? Like this nonsense, like making people feel as much as possible, even though it's ethically like not what they truly need, just for the copay, for the money, right? And after a while, it kind of ate away with me, like realizing that this is what I'm supposed to do for the next 40, 50 years until I retire. I'm like, this is not cool. This is not right. So I got really depressed. I got really anxious and really started hating my profession. I started hating me going into work. I started hating like my patients, like I started really hating my team. Like it was a really low, dark place for me. And I was like, man, I can't do this forever. What can I do to, one, get that fire back, that childhood like inquiry and about, the herbs, the medicines, like natural stuff and helping people. And two, I don't want to be depressed getting paid like six figures and being unhappy. It's ridiculous, right? So I ended up stepping down from Walgreens in 2020, 2019, and decided after seeing how being in Henderson showed me how our seniors were the ones most vulnerable to these social issues, to over medicating, to these duplicate therapies, side effects with all the drugs. They traditionally have more drugs, like 14 to 18 on average. That that is where the most harm is. So why does our health system continue to let this happen? Right? Why do they suffer the most? So I decided to start geriatrics with kind of the senior patient and caregiver in mind in an effort to develop deprescribing action plans. So strategic, scientific, evidence-based methods to get people off of medicine safely with their providers, so with their doctors, so we both had the same goals, right? And so that's what I've done since 2020. And our hallmark case was a patient in Clayton who was on 36 medications, 70-year-old, and was on the verge of being involuntarily committed into a nursing home because of dementia. And we find out it's not dementia, it's the 30 medications and 10 drug interactions with different families all causing these issues to be described as a walking zombie, right? To just be just in the room wasting away. It was heartbreaking for the caregiver who hired me, but it's like you work all your life to just die slowly, like not gracefully, not independently. And that was our first case. That was our very first case, 3 months after stepping down and starting this business. And why this case meant so much to me is because unfortunately there is a dark side to this story. This woman was on the verge of being involuntarily committed into a nursing home, and she was wealthy. So part of her family wanted to seize her assets, take her home, throw her in there so that they can get everything else and divvy it up amongst cousins. So it was really only the daughter who was like, I don't think it's her, it's the meds. And that's how she hired me. And needless to say, we were able to have the court drop the involuntary commission because of the testimony I gave with the medication report. So that was my life's calling. Like I was like, that was God saying, "Yep, that's it. That's what you got to do for the rest of your life. I'm going to do that for the rest of my life. I'm going to be the advocate for medications, or the drug whisperer, as Heather and I came up with when we first met." And that was, like to get that phone call saying, "We won, DeLon, like we won, like we don't have to." I was like, man, I've saved this family, and this happened 2 years ago, well over $250,000 just because of not being forced into a memory care unit. If you guys don't know, that's between 7 and 11K a month, and double that if you're in Cali or New York, uh, to take care of your loved one. So that was like my like little shed a tear moment for me. And, I'm a guy, I suck at that sometimes, but that was my moment of clarity that this is what I have to do, and I have to advocate in this well. So
Well,
in a
thank you so
nutshell.
much. for sharing all that. And when we first started Friday Facts, I saw even before I started it, when I started hosting, there was this real hope that folks would come on and be vulnerable, would share what truly made them passionate about their work, what motivated them. And so I want to take a moment to thank you for sharing your story about, in order for all of us to be able to be there for other people, we have to be there for ourselves, and we have to acknowledge, what gives us passion and what gives us fire, and also what's sort of bringing us down. And you got out of an environment that was bringing you down. And so tell us a little bit more about how your work now as a community pharmacist, as a concierge pharmacist, sort of define those terms and how that's now different from what I know of, what others know about what happens at Walgreens and what happens with you since you're not at Walgreens.
Yeah, thank you for that. So I'm basically a pharmacist unhinged. And so when you work in some of these big box settings, you're really confined to policy and those very same metrics. So when you deal with me, I'm not telling you to buy packets of cigarettes and alcohol 2 for 1 on Fridays, right? There's no incentive from insurance companies to get you on a certain drug or have you on a certain plan or have you get this certain thing. And so what I basically do is I work with families one-on-one 24/7. Like, so people will hire me on retainer, like how you may have a lawyer. And so I'm essentially communicating and advocating on your behalf to your providers, right? I'm creating and developing action plans with you and the caregiver on, all right, what do we do in our life? What can we change? Nutrition, whatever, motivational interviewing, stress management. What can we do holistically to reduce your pill burden and reduce your costs on the back end for paying for all these? So you're not going to get that anywhere in retail, right? They may tell you, all right, maybe this is interacting with this, but to have a strategic lens, as my board-certified geriatric pharmacy credential can tell, is that I have a targeted expertise in looking at what is going to be likely harmful for you. And there's a series of assessments and tests I'm doing throughout our time together to get you to the safest number of meds you can possibly take, which is, to me, the lowest you could possibly take, right? So you're getting a concierge approach to pharmacy, essentially. You're getting a holistic approach. So if you want to try naturals, cool, we can go that route and consider natural stuff. If you want to consider movement as medicine, we can go there. If you want to go to nutrition, diet, mindfulness, behavioral cognitive therapy, these are all tools to get you to goal, right? And I'm willing to recommend acupuncture. It's about the patient goals and, of course, what's scientifically sound, but also what's appropriate, right? And not everyone, as you realize when you're on meds for decades, realize that they can stop the majority of medicines safely. About 90% of medications can be stopped safely without really any strong repercussions. I can't tell people to just stop. You need to have permission from your doctor, but that's the whole point, is to give you this level of advocacy, this education that you don't just get when you ask, do you have any questions after your refill?
All right, well, we're going to get back. Thank you. And we're going to get back to some work around advocacy and education, but I want to throw 2 words at you for you to help to define for the group. So you've already talked a bit about what you do as deprescribing, but I really want you to tell us more, because as I follow you on LinkedIn and you're running education sessions and advocacy sessions, that's a big word, deprescribing. So it's sort of clear what that means, but what sort of energy are you trying to get around that? You're deprescribing accelerators. So dive into that word a little bit with us, even though it seems self-evident, but I feel like there's a big push around this effort.
Yeah, great. No, it's a great point. So deprescribing was coined like in the early 2000s, and it was actually by an Australian geriatrician who started seeing a lot of issues with the older population over there. And really, as it may intuitively sounds, we're doing the opposite of prescribing, but basically deprescribing is the supervised and targeted reduction of medications. It could either be a dose reduction or maybe simplifying 3 meds into 1 med, or it may be just stopping a medication altogether. But essentially, it's reducing the amount of meds being taken by a patient in a supervised manner, right? You can't just cold turkey all this stuff. You got to have someone guide you along. And what I'm finding in our health system is no one knows what the hell deprescribing is, right? Like Heather asked, like clinicians don't know what this is. So we understand, yeah, we can stop some meds, but truthfully, there are really no strong guidelines on how to do this. And so clinicians are between a rock and a hard place with, competing priorities. I don't know, our healthcare system, just they have 15 minutes to see all you and tackle all these many problems as possible. They're not trained in school of thought to get people off of medicines. They're trained to do the opposite. That's Western medicine in general. And I don't knock medicines at all. But when there's confusion among that, what I feel the need is as pharmacists is for us to kind of use our innate power of the medication knowledge to educate the provider and the patient. And so my mission with the deprescribing accelerator is to train clinicians on how to think like a deprescribing advocate, like how to implement deprescribing into these care organizations and health systems, and honestly do what's ethically and morally right. So what I find in this line of work is I go to nursing homes, I speak at caregiver conferences, I'm going to Alzheimer's Association board meetings. No one thinks to discuss this unless you're in like hospice or it's like all the way down the road of care, or you're of course older. Geriatricians think like this all the time, but your pre-CP, your family doctor, they're not thinking about that. In fact, they're probably renewing that med list of that drug you stopped 2 years ago because of inaccurate recording. So there's a system-wide issue where we don't address deprescribing. There's a community side where they don't even know that there's an opportunity to get off these meds. So deprescribing isn't just the actual removal of med, it's educating the patient, it's having a dialogue, it's the advocacy, it's weighing the pros and cons, right? It's getting buy-in from the caregiver. It's so many steps that leads to actually the product of getting someone off. So I use it loosely and specifically, but essentially, if the community doesn't know, I figure let's educate. Let's start with that. Let's start with the word. And that's why I come out weekly talking about this with our Red Pill versus Blue Pill live series. So it's educating the community first. And then as we do it together, the providers they're understand, okay, maybe I don't need to do this. Maybe we can, oh, you're right. We can stop half of these damn meds. What do you know? And that's the power that this med review can have. So that's what that means in a nutshell.
Well, this is it's important issues, and it hits me close to my own heart. I know that we have members of our patient engagement work group, and I know I'm part of the problem. If this is not actual prescription, but I know if I see the doctor and I leave with a prescription, I've won. We're doing something productive. We're going to throw a pill at whatever the situation is. And so there's lots of people that are like me, and that, it's changing that mindset that we can address issues lots of different ways. And it doesn't always have to be like you leave with something. All right, one more word of definition we're going to jump into, and it's the word that bonded you and I when we first met months ago on LinkedIn. And then I want to talk into your work with advocacy and community organizing, because we have just a little bit of time left. And as I'm about to ask my question, I do invite the members of the coalition, please feel free to throw questions in the chat. I got plenty of stuff for Dr. DeLon, but I want to respect if you have questions that are bursting to, or, confessionals like I keep doing. All right, we bonded over the word pharmacogenomics. When we first met, I was like, that's the coolest word. So tell us about how you do the pharmacogenetic testing. How do I get it on this and have this done with me? Like, what is this? And how do you use it in your private practice?
Yeah. So every patient that comes to me is required to get a pharmacogenomics test. So I know it's a long word, but essentially it's pharmacy and genomics combined. So it's the study of your genes and how they may interact with drugs. So this is the new wave of precision medicine, basically. We're able to allow patients to get a simple cheek swab delivered straight to your home. And with this cheek swab, I'm able to get a report on what meds you're on and whether your genes may have any interactions or problems with them. And so this has been around really since 2000s, but it was super cost prohibitive in the beginning. Now you can get these tests fairly cheap. Now Medicare pays for it, Medicaid pays for it, depending on certain providers. And really, it has utility all across the board. It's a once in a lifetime test. So this one report can tell you how your pain meds are going. It can tell you, how some people may need 5 oxycodons for pain, some people need half a pill. That variability a lot of the time comes from our genes, it comes from our body. And so with genetic testing, I'm able to get a better idea of, all right, just because of this blood pressure med, the way your body is, you're a poor responder, or you're a very efficient responder. And with this evidence, I'm sharing this report with their doctors. They can put it on record. So if they see something they may want to prescribe, they can just text DeLon, hey, we're thinking about this new psych med. What do you think? I can take a look at that profile and make sure, oh, wait, let's not start there. Let's try a different pathway. So it's a way to avoid side effects, harm reduction, better prescribing habits. We're being more efficient and not just throwing paint at a wall and hoping you respond. So that's the power of genetic testing. And yeah, every patient gets this, and I go over the results with the patient and provider once they use us.
That's so cool. So, like, do you have to be over 65? Like, what if you're almost 52? Would you take a
Yeah.
patient who's almost 52? Okay.
Yes,
All right,
absolutely.
cool.
So yeah,
Not
anyone
that this has
can.
become a
Yeah.
sales thing, but I love that.
Yeah. Any older
That-
adult can get a genetic test. In fact, children can get genetic tests. It's again once in a lifetime. So
and that insurance will cover it if you're on Medicare. We'll see about other insurance, but that's
yeah.
all right. Well, we'll talk more about that offline. But
Mhm.
I'm excited about that. All right. With our time left, you have done a lot in your home community now of Durham. I know about that through clearly as we stalk you. We know about it as your resume, but you and I know about it through our conversations, especially over the pandemic. Tell us about your work in addressing all kinds of healthcare, public health. I'll just let you go in your home community of Durham and other places throughout North Carolina, and the work you're doing, especially in the African American community, because I know you're on the African American Minority COVID Task Force. Talk with us about your community efforts.
Sure. So remember how depressed I was after working at Walgreens? I decided to, as I was starting my business, to do what I love, which is getting back to the community. And so during COVID, I started doing all the things I love to do. So I'm a part of the formulary executive committee with senior pharmacists. So that's based in Durham. They help 60 and up patients get enrolled in Medicare and do med reviews. And what we would do is just review their formulary to see what would be helpful for patients who are in the coverage gap on Medicare. So we can help cover some of those copays and expenses. So during that time, I started helping and discussing more about COVID to the group. And I would follow all the initial trials with Moderna and Pfizer because I knew we're going to be skeptical if we don't have really good evidence or at least good representation in these clinical trials. Because you can't just have wide sweeping vaccines and not have people you're trying to treat in the trial, right? So I started seeing a need and figured, well, I'm a pharmacist. I can at least talk through vaccines and talk about hesitancy and misinformation. And so I started presenting more and more about COVID to local small groups, where I eventually in the fall got invited to be an exec board member of the African American COVID Task Force based here in Durham. So it's really a coalition of amazing people who are community facing, researchers, clergy, health professionals, all different fields across the state, but we're based in Durham. And we would meet once a week. We still meet once a week, and discuss vaccine misinformation. We were first to advocate for those in need in marginalized communities because we didn't have testing available, right? There's a time where we couldn't get a test anywhere. You had to go all the way out of these poorer communities to get that, and they couldn't do that. In fact, we were seeing people from other communities go to the poor communities, the Black communities, Latina communities, to get testing, and it wasn't representative of the need. So we were the ones basically yelling to health systems nearby to give us the tools to help advocate. And so we would meet. I would help discuss and dispel misinformation. I'd be on town halls, panels, and eventually this momentum led to me being on the news. So I've been on the news quite often with Spectrum, talking about the FDA pause with Johnson and Johnson, all for the last 2 years, and eventually led to that being on PBS, Black Issues Forum, talking again about vaccine hesitancy, misinformation, talking about, Tuskegee experiment, past, grievances, medical issues. But it got me so grounded to realize, all right, you can't just throw people, the guideline. You got to understand where people are coming from and have that empathy to really enact change. And that translates to my work really with my business, is understanding that you got to meet people where they are and come with a level of care versus you got to do this because the government says so. So that was a ride. It taught me so much about myself and the world of the nonprofit space. And yeah, it got my hands dirty to really be the voice for those who need. And I still have a running commercial on WNCU's jazz station talking about vaccines. So yeah.
All right. Well, we just have a few minutes left, but I had a whole other line of questions that I wanted to dive into. As your persona, you've become quite the media personality, social media. The teens would call you what, an influencer, but you really are using all kinds of different, both traditional media with television, radio, and then we're seeing you, Virginia saw you, followed your LinkedIn Live education sessions, your YouTube. So you're really using all kinds of platforms to get your word out. And my last question is building off of something you just said, which is try to bring about change and your work to bring about change. That's what the coalition's about. We're the North Carolina Serious Illness Coalition. We're coming together to try to bring about change either in programmatic work or in policy work. And so as your role as a pharmacist, what change would you like to see? And basically, how can we work together? The role of pharmacy in bringing about healthcare policy change, healthcare programmatic change. What are last words that you want us to know about in terms of working together and to bringing about that change? So there's like 3 questions smushed into one.
Yeah. I think the biggest takeaway is for our community members and providers to understand that this medication mindset we have, this dependency for a pill, it can be checked, it can be challenged. You can be your own advocate. So every patient is the CEO of themselves, right? So I think a lot of what I do, again, is education and advocacy. So if there's a way to continue reaching more people's homes on ways to question what they're on, having quarterly reviews, if your loved one is on more than 5 meds, that's usually a good red flag to be like, all right, what can we do to safely get them off? Like, don't make it accusatory, just make it a question. And you'll be surprised that, some doctors respond to that and they want to get you off. See, some doctors do. It's just difficult. But there has to be a shift in the patient's mindset of wanting this, right? You have to want to make this change. You can't just, well, I'm going to do the same thing and just get me off. Like, you got to take active steps and some ownership to make that happen. So the biggest takeaway is for us as a people to shift our medication mindset, to don't be afraid to push back, to ask. And in terms of collaborating, I mean, I don't know how, but it's easy for me to get on and speak and reach more voices. So if there's panels or discussions, podcasts, I think we can do live. We can always do an a session that's more in depth to get the message across.
Great. Well, we love collaborating and we know collaborating, so don't you worry. We're going to be pulling you in both into coalition activities, both in terms of our meetings as well as actual some of the more educational and advocacy outreach events. So yes, this is the first of many times you're going to be with the coalition, no doubt. I can't thank you enough. Thank you for sharing. Thank you for doing what you're doing. I know it's important work. I know it's hard work. I know it's emotional work, both on your side and with your patients. And so it's so important. And really, on behalf of the coalition, keep doing what you're doing. And to the coalition, have a wonderful Friday, and we will see you all soon.